Hi, my name's Chuck Pusateri. I'm a retired insurance advisor, and I volunteer with the Canadian Diabetes Association here in Victoria. Diabetes is something that I guess I ignored for quite some time because I have a personal health history of heart disease, and I spent many years sort of dealing with the effects of that and what I could do to help myself in those areas. And then diabetes was in my family. My grandfather, my father, my sister, uncles, were all diabetic to some degree, and I knew that it was kind of out there, but I was in denial, I suppose, that it was going to get me eventually, but I was aware of it until I guess after one of my heart surgeries, I came out of hospital injecting insulin, and so that got my attention very, very quickly. Since then, I've been trying to be more diligent in understanding it and trying to forestall it so that it doesn't, I don't get the effects of it as much as I might if I continue to ignore it. My current role in the CDA is what they call a regional chair for Vancouver Island region. There's 23 regions across the country for Canadian Diabetes Association, and a regional chair is supposedly what they call the lead volunteer. I came to the CDA originally to volunteer because I needed to understand more about diabetes for my own situation, and I knew that if I was involved with an organization like CDA that I would be sort of surrounded by people who were involved in the disease, and I could have good access to resources, and I would tend to look after myself better, to walk the walk and not just talk the talk. If I was in front of people speaking and telling them how to lead healthier lifestyles, then I probably would lead a healthier lifestyle. So what I do is I assist the staff that are in the Victoria office and the Nanaimo office here on the island from a volunteer perspective as to what we who have prediabetes, diabetes are looking for and what we need, and help to communicate with the national office back east. I think that it really surprised me when I started to be involved and volunteer with the CDA how significant, how big the disease was, how many Canadians are affected. They throw out stats like 9 million Canadians either have diabetes or pre-diabetes. Like, that's 1 in 4 people in Canada, and it's a huge number, and I know it's getting worse. And I look at the incidence of young people, and I look at my own kids and grandkids, and I look at their lifestyles, and I look at the way they eat, and there's a lot we can do, and yet we don't seem as a society or as a people in Canada to be, and in the United States, I think worldwide, we don't seem to be doing as much as we could possibly be doing. So I'm hopeful that somehow the world is going to wake up to how big this is and how it can potentially get really out of control, and to start to buy into healthier lifestyles through what they eat and their physical activity and whatnot, so that there's going to be slowing down of diabetes, perhaps a curtailing of diabetes, maybe a reduction ultimately in the number of people that are diabetic as opposed to the huge increases that are being forecast.